Welcome back to Senior Strength Show, where we address the real, practical challenges of aging with dignity and confidence. I'm John, your host, and today we're tackling a topic that many seniors struggle with, but few feel comfortable discussing: maintaining proper hygiene after using the toilet. If you're over 60 and finding it increasingly difficult to clean yourself properly after toileting due to mobility issues, arthritis, or flexibility limitations, you're not alone. This challenge affects millions of seniors and can lead to infections, skin irritation, and a devastating loss of independence and dignity. Today, I'm honored to be joined by Japan's oldest practicing physician, who at 103 years old has spent decades helping elderly patients maintain their dignity and health through practical, innovative solutions. He's developed simple techniques that have transformed the lives of thousands of seniors. Doctor, welcome to Senior Strength Show. And to all our listeners, if you've ever said ouch while trying to reach back there, go ahead and hit that subscribe button. Trust me, your future self will thank you.
Thank you for addressing this crucial topic. Personal hygiene after toileting is fundamental to health and dignity, yet it becomes increasingly challenging as we age. What I'll share today are practical, gentle solutions that preserve independence while ensuring proper cleansing and health.
Many people don't realize how something as simple as cleaning after using the toilet can become a major challenge with age. Can you explain what makes this so difficult for seniors?
The difficulties seniors face with post-toileting hygiene stem from several age-related changes: decreased flexibility in shoulders and spine, arthritis in hands and wrists, reduced grip strength, and sometimes cognitive changes that affect coordination. Traditional toilet paper requires reaching, twisting, and precise coordination that becomes painful or impossible for many elderly people. This can lead to incomplete cleaning, which causes urinary tract infections, skin breakdown, and serious dignity issues. In my practice, I've seen seniors develop depression and social isolation simply because they're embarrassed about their hygiene challenges. This is completely preventable with the right techniques and tools. What are the health consequences of inadequate cleaning? The consequences are serious, especially for elderly women. Incomplete cleaning can cause recurrent UTIs, which in seniors can lead to confusion, falls, and hospitalizations. Skin irritation and breakdown can create open wounds that are slow to heal in aging skin.
For men, poor hygiene can cause painful skin conditions and infections. For both sexes, the psychological impact, embarrassment, loss of confidence, fear of social situations can be as damaging as the physical consequences. What is the first solution, doctor?
The first solution I teach is the reach extension technique using a simple toilet aid. This is a long-handled device with a gripping mechanism that holds toilet paper or wet wipes, extending your reach by 15 to 18 inches. The key is choosing the right device. Look for one with an ergonomic handle that doesn't require tight gripping, and a mechanism that releases toilet paper easily after use. The technique is crucial. Instead of trying to reach around your body, lean slightly forward and reach between your legs from the front. This requires much less flexibility and puts less strain on your shoulders and back.
How do seniors learn to use these aids effectively?
Practice when you don't actually need to use it. Sit on the toilet fully clothed and practice the motion with the aid and toilet paper. This builds muscle memory without the pressure of an urgent situation.
Start with more toilet paper than you think you need. It's easier to manage and provides better coverage. Always pull the toilet paper taut in the gripper before use.
My patient, Takeshi, 79, had given up independence because he couldn't clean himself properly. Within 1 week of learning this technique, he regained confidence and was able to maintain his dignity completely.
That sounds like a game changer for many older adults, but I know some seniors find even that a bit difficult. What else could work?
The second solution is portable bidet systems, small, handheld devices that use water pressure for cleaning. These are revolutionary for seniors with mobility limitations. Unlike traditional bidets that require special toilet installations, portable bidets are small bottles with angled nozzles that provide targeted water streams. They're completely portable and require no installation. The technique is simple. Fill with warm water, position the angled nozzle, and gently squeeze. The water pressure does the cleaning work, requiring minimal physical effort from you. What should seniors look for in a portable bidet? Choose one with an angled nozzle that allows you to clean from the front position. This requires the least flexibility. Look for a capacity of at least 400 milliliters so you don't need to refill during use. The squeeze mechanism should be easy to operate with limited hand strength. Some models have pump action tops that are easier for arthritic hands than squeeze bottles. Temperature is crucial. Use lukewarm water, never cold or hot. Cold water can cause shock and discomfort, while hot water can cause burns on sensitive skin. Mrs. Yamada, 82, with severe arthritis, found traditional cleaning impossible. The portable bidet transformed her life. She could clean effectively with minimal hand strain and regained complete independence.
Okay, warm water in a bottle. Pretty clever. But what if you're out of water, out of patience, and it's 2 a.m.? Please tell me there's a wipe for that.
The third solution is specially designed hygiene wipes for seniors. These aren't baby wipes. They're larger, stronger, and pH balanced for adult skin. The advantage is they require less precise coordination than toilet paper, provide better cleaning with fewer passes, and often include skin-soothing ingredients that prevent irritation. Choose wipes that are unscented, alcohol-free, and specifically designed for adult personal care. They should be large enough to provide good coverage and strong enough not to tear during use.
How should seniors use wipes effectively?
Use the same front-to-back technique, but you'll need fewer wipes than toilet paper squares. Start with one wipe and use additional wipes only if needed. The key is gentle patting rather than wiping. Let the moisture and texture of the wipe do the work. Always dispose of wipes in the trash, never flush them, as they can cause plumbing issues. For sensitive skin, pat dry with toilet paper after using wipes, as remaining moisture can cause irritation if left on the skin.
We move to the next solution, doctor. The fourth solution involves positioning aids that make cleaning easier by improving your sitting position and stability on the toilet. Raised toilet seats reduce the distance you need to reach, while toilet safety rails provide stability and support when leaning forward for cleaning. A small footstool can also be helpful. It raises your knees slightly, which can improve your reach and make cleaning easier without straining your back. What about bathroom modifications? Simple modifications can make a huge difference. Installing grab bars provides stability and confidence. Good lighting is crucial. Many seniors struggle with hygiene simply because they can't see properly. Consider a small basket or shelf within easy reach to store your cleaning aids, wipes, or portable bidet. Having everything accessible reduces stress and makes the process smoother. Mr. Sato, 85, was falling frequently trying to clean himself. After installing grab bars and a raised toilet seat, he could maintain balance and clean effectively without fear of falling. Doctor, what's the proper technique regardless of which method someone chooses?
The fundamental principle is always front to back, especially for women, to prevent bacteria from the anal area reaching the urogenital area. This prevents UTIs and other infections. Use gentle pressure. Aggressive wiping can cause micro tears in delicate skin that heal slowly in elderly people. Multiple gentle passes are better than one aggressive wipe. Check your work. Use a mirror if necessary to ensure complete cleaning. This might feel awkward initially, but it prevents the health consequences of incomplete hygiene. What about skincare after cleaning? For people with sensitive skin or those prone to irritation, apply a small amount of barrier cream after cleaning and drying. This protects against moisture and friction. Change undergarments daily and immediately if they become soiled. Proper clothing hygiene is as important as proper toileting hygiene. Watch for signs of skin breakdown, redness, soreness, or small wounds, and address them immediately with gentle cleansing and protective creams.
When should seniors ask for assistance with toileting hygiene?
Great question. It's actually really important to ask before things get bad. If you're feeling pain when cleaning, or you keep getting UTIs, or even just some skin irritation, yeah, those are signs your current method isn't really working. Don't wait until you've got an infection or you end up with an injury. No. Occupational therapists can step in way earlier. They'll look at your movement, your grip, your setup, and offer something that fits you. It's not one size fits all. And hey, family members or caregivers, they can learn how to help too. Gently, respectfully. There are ways to assist without anyone feeling, awkward or ashamed. It can actually strengthen the bond when done right.
Yeah. What about professional caregivers?
Oh, absolutely. They're trained specifically to assist with dignity in mind. They're not just helping, they're preserving comfort and confidence. And often, they'll show family members the ropes too. What tools to use, what to avoid, even little tricks to make things smoother. Look, asking for help with hygiene, that's not giving up your independence. Not at all. It's taking charge. It's saying, I want to feel clean, safe, and respected. And that's power. That's self-care. That's how we protect the quality of life you deserve.
Doctor, how can seniors maintain their sense of dignity while addressing these challenges?
Dignity isn't about doing everything alone. It comes from taking smart steps to care for yourself. When you take action early to protect your hygiene and health, you're not losing independence, you're owning it. Using aids or new techniques isn't a sign of defeat. It's a sign that you're adapting, you're being thoughtful, and honestly, that's strength. Everyone goes through changes as they age, but the folks who age well, they're the ones who adjust, who stay flexible, but never drop their standards. They find new ways to keep doing things their way, and that's what keeps their confidence strong. Privacy makes a huge difference too. Don't rush. Give yourself space. Set up your bathroom so it feels safe and comfortable. Good lighting, grab bars, your essentials close by. All those small things, they add up. They help you feel steady, secure, and in control. Just know this. You're not the only one navigating this. Far from it. Millions of seniors face the same challenges. And for every single situation, there's a solution out there. You're never alone in this.
Doctor, what's your final message for seniors who are struggling with these hygiene challenges?
Well, I'm 103 years old, so trust me, I've felt those changes firsthand. Our bodies don't move like they used to. Things take more time, more effort. But here's the thing. Keeping yourself clean, that's not about vanity. It's about health. It's about confidence. It's about feeling like yourself. And those things matter, more than ever as we age. I get it. Sometimes we feel embarrassed. We think, maybe I should just deal with it quietly. But please don't let that stop you. Every challenge you're facing, someone else has faced it too. And you know what? There are real, practical solutions out there that work. Your dignity doesn't come from avoiding problems. It comes from the way you face them, with clarity, with care, with courage. Using tools, learning techniques, asking for support when needed. That's not weakness. That's wisdom. That's strength.
That's such an important message for anyone dealing with these kinds of struggles. To our listeners here on the Senior Strength Show, just remember, your hygiene, your comfort, your dignity, they're not luxuries. They're your right. And sometimes the right tool or the right advice really can change everything. Before we wrap up, if today's episode helped you or someone you care about, go ahead and subscribe to the Senior Strength Show. We're here every single day with honest conversations about what really matters, from hygiene and mobility to memory, joint pain, emotional health, and more. Click that subscribe button so you don't miss what's next, because aging, yeah, it's inevitable, but struggling through it alone, that doesn't have to be. Until next time, stay strong, stay informed, and stay proud. Thank you, Doctor. And thank you to everyone listening. And hey, don't miss tomorrow's episode. We'll be talking about a simple 5-minute bedtime ritual that could completely change how you sleep. Soak your feet in this before bed and sleep like a baby. See you then.